This vaccine is against the HPV virus, which, like we said, is the one that transmits this particular cancer. So let us know, do you know anything about cervical cancer? Do you have any knowledge whatsoever about this HPV? Do you know how it's transmitted? Do you know how it is caused? Do you know of anyone who has basically gone through that? Now, someone is saying, movie panga paper vizuri kwa Manchester United hapo. Well, my question to you would be, as I panga my papers, what do you know about cervical cancer? And by the way, if you're an individual dating a woman or a girl, have you made sure that these people have gone for screening? That is one of the most important things that people need to know. Screening is the only way to prevent this particular kind of cancer. There is no other way that you can be helped because once it's there, well, apart from chemotherapy and radiotherapy, nothing much can be done. So prevention is always better than cure. But right now, joining us all the way from Hampshire Hospital, we do have Shiko Kaitani. Shiko, once again, a very good morning to you, and probably can tell us what is happening on your end.
Bobby, we really do have a rather different approach to our programming this morning. Like you said, we are coming live from the Cancer Center over at Hampshire Hospital to drive one message home that screening really does matter. Now, you may not know this, but cervical cancer can be prevented. In fact, it's said that the rate of death from cervical cancer, especially in the West, has reduced dramatically because, of course, the advancements in science. Now, this piece of good news can be our story too if we take action as a community for change. And so because this week is Cervical Cancer Prevention Week, we want as many people as possible to know how they can reduce the risk of this disease and, of course, to educate not just women but men too. I'm very happy to have on the show Dr. Adarsh Chandra, who is an oncologist from Hampshire. Welcome to the program.
Thank you.
And then, of course, our very lovely health advocate and the founder of the Kilele Challenge is Benda Kithaka, back again with us. Hi.
Hi.
Oh, so good to see you, and thank you for making time.
Thank you.
All right. Yes, does it feel nice? We're out of the studio, right?
Right. Not all those lights and everything.
Right.
So this is easier.
Okay,
Yeah.
So we do have lots and lots of information that's going to be helpful for you today on the show from our Daktari as well as our health advocate. But Benda, just starting off with you, you know, we understand the theme this year is smear for smear. What really is the message behind this campaign this time around?
So you know one thing, the smear for smear is actually in the UK.
Right.
But in Kenya, we're taking it as we need to accelerate cervical cancer screening.
Right.
The reason being, right now with COVID-19 situation, with the fears that go with it, there is even bigger barriers to screening.
Right.
Women are afraid to go to hospitals, as well as there is the systemic issue of getting to first know your COVID status or even get to look at your signs and symptoms before you go to the hospital. So we see that already as a barrier, but we're saying it should not stand in the way of prevention.
Right, absolutely.
We need to take charge and have health in our hands. So it is about accelerating cervical cancer screening for prevention.
All right, amazing. Daktari, one of the frequently asked questions that you find that come through from some of our viewers, for example, is about the manifestation of this particular cancer, because you wonder, how does someone move from what you would probably describe in a layman's language, stage 1, and before you know it, the diagnosis is showing that they have a very aggressive type of cancer without even knowing?
Yeah, this cervical cancer, basically the symptoms manifestation depends on the stage, which can be from early stage like stage 1, stage 2 to advanced stage like stage 4. Earlier the symptoms can be like intermenstrual bleeding, or it could be postcoital bleeding, like that, or it could be a simple vaginal discharge which can persist for a longer time. Okay. As the stage advances, the bleeding can increase. It can become more frequent, more in quantity, and it can be, anytime it can, spontaneous bleeding can happen. Okay. And as the patient advances to stage 3, there could be onset of pain in the pelvis, which could be, which could stay for a longer time.
Okay.
And in very advanced stage like stage 4, whether the bladder and the rectal, the surrounding structures are involved, there could be, the patient can't control the urine, all those symptoms, increase in the frequency of passing stool. Patient even can see blood in the urine or stool. Sometimes along with this, they can also have general symptoms like loss of weight, loss of appetite. These are the symptoms.
Well, let's try and look at things from a woman's perspective, though, Benda. If you think about it, in fact, I did know this, that something like the Pap test apparently was introduced in the West probably like 50 years ago.
1946.
Yeah, but in your opinion, what really is the reason of this low uptake of screening in Kenya?
Shiko, even before I go to the reason for the low uptake, I want to take us back a little. Dr. has talked about stage 1, stage 2, stage 3, stage 4. Did you know there is even stage 0 and there is pre-cancer of the cervix?
Right.
And screening is not so much about finding the cells, it's so much about preventing cervical cancer.
Right.
Because the screening test can find out way before you get the signs and symptoms. It can find that there is something happening in your cervix that if treated early will be preventing cervical cancer at the pre-cancer stage. Wow. Okay, so now let's go to the reasons why there is low uptake. The biggest reason is what I call barriers to access. Okay? There are women who don't know that cervical cancer is screenable. They don't know that it's the one cancer that gives us time. And I've said this since 2012, when we started talking about cervical cancer. It's one of the things that gives us time way before it becomes cancer that we can prevent. It's also lack of awareness that we have health in our hands. It's our choices. For example, I've had women, even on social media yesterday when I posted and said I'll be on TV today, someone says it's uncomfortable and it's intrusive. And the truth of the matter is, it is. But guess what? So is wearing heels. It's uncomfortable and it's intrusive. If you start from morning to evening walking in heels, by the end of the day you will be so tired, you will be wishing to kick them off. But this is an everyday affair. Cervical cancer screening is a once in every 3 years, once in every 5 years affair. Discomfort for 15 minutes compared to a life-threatening disease. So barriers, when you talk about the fear of screening as one of the barriers, when you talk about the stigma, I don't like people looking below my belt. Guess what? When we're getting babies, I'm a woman, I have 3 children. I've had to visit the gynecologist, not the 3 times that I've had the baby, but every single gynecological visit, the doctor checked me. So
what choice do you have?
What's this about this?
And I can imagine, I mean, the issues in terms of like the barriers that you're talking about, even culture or religious issues coming in the way, because you can imagine someone who's been born and bred in perhaps in a rural part of this country. How then do they go and tell now their husband, by the way, naenda kuangaliwa huko chini?
Let's even talk about barriers and culture. The one that's never mentioned. For the longest period of time, our women used to go through FGM. And you know that's invasive. And you know that's not even acceptable. But because it's cultural, it was taken as we are taking care of your below the belt. And then, unfortunately, women feel self-conscious about this. In the rural villages, they're like, I don't want anybody to check me there. It's only my husband who ought to visit, not even check, visit that area. But the thing is, it's about health. It's about taking charge of ourselves. As women, we ought to say, yes, culture served in those days. Culture now is, if you're not taking care of yourself, the risk of having cervical cancer is so much higher for all women. And it's not about men stigmatizing, women stigmatizing. It's about you knowing that the earlier you know, the sooner you know, the easier it is to prevent.
It really does.
The less invasive in treatment it is, and Dr. can speak into that. That if you find a stage 0 or you find a pre-cancer, it's so much easier to treat.
Yes, the options are quite easier. Even in earlier stages, there could be just like in advanced stages, there could be need of other treatment, like removal of uterus, radiation, chemotherapy. If it is diagnosed in very early stages, a part which is abnormal, it can be taken out.
All right. We want to also rope in our audience at this particular time. If you are watching this particular show and following the conversation and have any questions at hand, why don't you send us, of course, those questions to our WhatsApp number, also through our social media platforms. I encourage you to follow me on my personal platforms, which is at Shiko Kaitani, and we'll be able to just bounce off ideas and some of the questions you may have to our Daktari and our health advocate in studio. Now, doctor, at some point, we heard so much about HPV infections. And I want us to go back to basics, okay? Because the conversation sort of did die down. There's also a lot of ignorance around what HPV really is. So take us back to the basics about what HPV is.
So basically, HPV stands for human papillomavirus.
Right.
It's a virus which the infection is acquired sexually. Okay, it could be through vaginal route or anal route or oral route.
Right.
Okay. So almost it causes number of cancers, mainly cervical cancer. It can also cause anal cancers. It can cause oral cancers. Okay. But almost globally, around it is known that around 99% of the cancers, cervical cancers, are related to this site. There are HPV. There are different types of HPV, like we type serotypes.
Right.
Okay. We classify them to high risk and low risk. Mainly, there are around 15 high risk viruses. Among them, 16, 18, they are male.
Right.
Which causes around 70% of cervical cancer. Basically, it's a chronic infection, which is the reason for development of cervical cancer.
Okay.
Most of the women, once they start their sexual activity, they will get positive for the HPV infection. But not everyone gets the cancer.
Right.
It's only like because of the self-immunity, the infection can go down within next 2 to 5 years.
Right. Okay.
Those who have the persisting infection, so there could be the virus can change the cells in the cervix to cancerous cells.
Okay. Okay. And because when you talk about HPV and understanding that it's a very common sexually transmitted virus, Benda, can you imagine the controversy that was around the vaccine? And I want to understand what your take is on that, because it certainly says a lot about the woman at hand, because he said once a woman starts to have sexual activity, it speaks about you as an individual. And so people were saying, especially when it comes to underage girls, why are they getting the vaccine as young as 13? Are you trying to promote girls to be promiscuous,
So I like what you've said about the issues around sexuality, promiscuity, misconceptions and misperceptions. Dr. has mentioned HPV, human papillomavirus, is so common that anyone who has ever had sex at any one time or another has actually probably caught it. And because there are so many different types of HPV, 16 and 18 being the most common that cause cervical cancer, the risk that you've caught it at one point or another is so common. In some women it clears, in others it doesn't. I've said women. Girls, on the other hand, because the expectation is that they've not started having sex. The way immunization works, the way vaccination works, is we introduce the virus in a weakened state in the body early enough for the body to learn how to fight for itself. The same with whooping cough. The same way with other measles and polio and all the others.
Absolutely.
We don't wait for the person to catch the disease so that we start immunizing.
You build your antibodies.
We help them build their antibodies way, way early. That is why girls the age of 10. So that in Kenya, it's free of charge, it is safe, it has been proven globally to be cervical cancer prevention, and because it is for our girls and the government is providing it for free, we encourage girls, go get vaccinated. So that by the time you're a woman, my word, by the time you're a woman and you started having sex, and therefore you're introducing HPV into the body already knows what to fight and how to fight. And I'll take it back to the men. So the stigma is on the woman. Men are thinking, oh, that doesn't concern us. It's about the woman. Okay. One, Men are carriers, women are sufferers. So if I'm getting it through sex, where did I get it from? It's a man. So it's in our best interest as a community to stop focusing so much on the girl child and the woman, to start educating both men and women that it concerns all of us as a community. And the way to do that, get the man in the house to tell his woman, go get screened. Get the man in the house to even allow and encourage and even take the daughters who are age 10 to get vaccinated. That's how we're going to beat this disease.
Wow.
Yes.
All right. So we've got 2 screenings, Daktari, that help in terms of prevention of cervical cancer. We're talking about Pap Test, HPV test being also one of them, which is still, a very green type of examination, if you ask me. Can you really tell us what the Pap Test is really set to detect, and what does the HPV detect?
So Pap Test, what we see usually changes in the cervical cells. So there will be early changes of cancer that you can detect in the cells. So the Pap Test involves vaginal examination, clinical examination, under sufficient light. Then we observe, we just take a smear around the cervix. We take cells which are shed by the cervix and we look in the microscope. Okay. So if any abnormal cells are there, we can subject for further testing or biopsy, like those things. So basically we have, as we discussed earlier, there are early stages of cancer, pre-invasive stage. We call this CIN, that is cervical intraepithelial neoplasia. There are different grades, 1, 2, 3. So we see for those changes, which is because of the HPV virus. That is one way we detect, screen the cancer. The other one is HPV testing. So the cause for these changes is HPV virus. So we check the presence of HPV infection, HPV DNA. We do it from the same sample. We check for the HPV virus.
Okay. All right. So I guess we'll get more into the practical aspect of it once we come back from a break. You really do want to stick with us for that. But let's get back into the the work that you do on the ground, Benda, for a second before we take a break. And I'll ask my director, obviously, to let me know in just a second. But there's all sorts of treatment and combination that patients go through, whether it's surgery, radiation, chemotherapy. Tell us the thoughts and the experiences of cancer patients and survivors, as what they have had to endure through some of this horrifying situations.
For over 9 years, Shiko, I worked in the space of screening only. And it was awareness and education, go get screened, go get screened. Then it occurred to me last year when we lost a very good friend of mine to cervical cancer. She was an amazing advocate. If you Google, you will see Rose. She was amazing. And then it occurred to me that we talk a lot about screening and early detection, but we don't go to ask the people who have actually been through it and to ask them, how is it? And why should I prevent? And I can tell you, last year we took a trip up the mountain, Mount Kenya, and majority of our work involved talking about stories with survivors of what they've gone through. Shiko, we talk stigma of the screening. We haven't faced stigma. Self-stigma of, it's uncomfortable to get screened is not the same as stigma that you've been found to have cervical cancer and your husband lives. It's not the same as stigma of the community starts saying you're promiscuous, you're no longer fit to be a member of the community, you're teaching our girls bad things, so they shun you. Or they start looking at you and saying, this one is walking dead. Cancer kills, so we don't want to see her around us. She's a money drain, And so, Shiko, when we talk about cancer and we talk about survivors, the one rallying call I hear very often is, and especially when you say cervical cancer is preventable, the one rallying call I hear is how I wish all cancers were preventable like that. There was a vaccine for it. How I wish the people would embrace screening so that it's one cancer we can wipe off the face of the earth. How I wish people would take seriously their health to know that society should not prevent prevent you. Stigma should not prevent you. Your own perceptions of how uncomfortable it is should not prevent you. But you should take charge and go get screened. Because, Shiko, cancer, some cancers are preventable. 33%, the World Health Organization says 33% of cancers are preventable through lifestyle management, through modifying the risk factors and reducing the risk factors. Cervical cancer being one of them. Reducing the risk factors means sticking to one partner so that we're passing the same HPV, or getting screened early so that we minimize the risk of invasive cancer. Secondly, vaccinating the girl so that she minimizes it absolutely, totally. Okay? It's the one cancer that gives us time. Let's not wait to be survivors. You know? But also, let's love our survivors. They go through a lot. They didn't choose it. The best thing we can do is embrace them as contributors to the community. And they come back and give real life stories so that when they talk about it and we're listening, we say she's walked that path. Experience is the best teacher. I don't need that experience for me to experience it, for me to learn that I can prevent it. Let's prevent.
And even for you, dear viewer, if you do have a loved one who is going through this particular journey and just cancer in general, why don't you also share your story with us, even words of encouragement for other viewers? We're going to be sampling some of your text messages in just a moment. I would like us to take a short break so that we can also start looking at what's coming through social media. We're going to be back in just a minute with Daktari and, of course, Benda as we talk more about cervical cancer prevention. Is the director talking to you? I cannot hear him. Abu? I can hear you. Abu? Maze, you have to keep talking to me. I will not know what's happening. You know me, I don't have a monitor. I don't have anything on this side. Yeah. 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 Okay. That sounds good. Zinaingia. 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 The messages, are they coming? Okay, awesome. Only 3. Ama? Yeah, we're supposed to be going down, right? Yes. Oh, let's go. No, we are going for part B there because we won't be able to. So how are we doing this?
So I'll leave this here, right? We don't need to count this, right? Do we need to count?
Yeah? No, we won't be ready in a minute. We have to go. We are going to the lower ground. So ambia tu mbuvi asome.
Yes.
I can hear you.
We saw you live. It was really good. You want to be? Yes. Those are the ones we want. I think you need to understand. No.